When I came out, I was 18.
Fairly young as an adolescent.
When I came out, I was an adult.
I was in college when I came out.
I came out at a time that was the beginning of the AIDS pandemic and everything was kind of terrifying for people everywhere.
I fell deeply, madly in love with a girl who did not love me back.
In front of my grandmother, my aunt, and my great aunt. And I felt empowered to do that because I did that here at Fenway Health.
Fenway has a strong legacy over the past 50 years of opening up access across the continuum of care, and I'm excited to lead Fenway into the future.
What Fenway represented was this beacon of hope and help that was just not available anywhere else.
I want people to know that when they choose Fenway Health and they walk through our doors, they will receive culturally responsive and affirming care.
There was not one place when I could get a full range of care as I do here at Fenway Health. Although I've had some challenges with Fenway Health, I think they do try to take into consideration who I am as a person of color, as a queer woman, as someone who has struggled with trauma in my life.
I'm with Fenway because the rest of the world is built for heterosexual normativity and straight people, and this is not.
Fenway has been my spiritual, my cultural, my medical home for a long time.
I found Fenway when I was ready to start building my family.
It was HIV that really got my father focused on the challenge and the importance of this organization.
There are lots of places where LGBTQ people can get their health care, but that is largely because Fenway has set the standard and continues to set the standard.
I think we've done a great job with some constituents of our community, and we still have more work to do with others, and I'm looking forward to seeing progress there.
And that includes those who are underrepresented, those who are marginalized, and those who have experienced a lot of trouble gaining access to health care. I think the new CEO is going to do a great job in providing us with the type of care that those marginalized communities deserve.
Fenway has a very special place in my heart. I believe in my heart deeply that if my sister had known about Fenway, she would not have passed away at the young age of 50. She would have gotten the care she needed right here at Fenway.
We have a big education center, we have all this exciting research going on, and at the same time providing primary care for about 30,000 people in the community.
I came here as a patient and I was extremely well received. It really helped me find my way.
We are an organization that is staffed by the community, members of the community, providing care for the community, and that is a different and unique experience for our patients.
If I were to advise anybody that hasn't had the opportunity to lean into philanthropy, I would just remind them that it's as great or greater for them as it is for the recipient.
I'm super excited where we are at this point in our journey at Fenway Health. We are open and welcoming new patients. Our care delivery services are delivered in an integrated way. Behavioral health, gender affirming care, HIV care and prevention, all of that is delivered within primary care. All providers are expected and trained to deliver that care.
A true leader in care, innovation, and access for the LGBTQIA+ community in Boston and beyond.
Having healthcare that deeply understands the needs of a community, it's not only essential in terms of providing and making sure that we are cared for physically, also mentally and spiritually, to have a place where you are not only cared for but accepted, celebrated, that there is no barrier or shame or any sort of hurdle to get over in explaining the things that you want to move towards, whether it's trying to have a baby or whether it's gender affirming healthcare, whatever that might be. There's no judgment.
Fenway cares, and that is one of the reasons why I continue to support Fenway Health.